Welcome to our channel Hashmi Clinics.
Welcome, everyone. In this clinical deep dive, we're going to be focusing on Argentum Metallicum. Our goal here is to really move beyond just the textbook definitions and build a clear, clinically relevant picture of this profound remedy, especially for those of you who are already in practice or in your advanced studies. I want to start with this quote because it just so perfectly captures the absolute core essence of this remedy. We're talking about a state of premature decay, a deep, deep constitutional exhaustion. So I want you to picture a patient who just seems old before their time. This is really the foundational idea that should pop into your head whenever you're considering Argentum Met. So here's our roadmap for today. We're going to start with the remedy's core essence, then we'll move through the mental and the physical picture, and then we'll really focus in on the clinical action and the modalities that are going to lead you to a precise prescription. Okay, let's begin with the foundation. What is the constitutional nature of an Argentum Metallicum patient? What does the state of premature aging actually look like when they walk into your clinic? Well, these are the fundamental traits you'll see. You're looking at a patient who seems constitutionally withered, fragile, often tall, thin, with a pale, almost careworn expression on their face. And they're deeply chilly, yet this contrasts with their desire for fresh air, which is interesting. But crucially, what I want you to remember is its profound affinity for the body's scaffolding. We're talking cartilages, bones, joints, and especially the larynx. Now, let's move on to the mind. Because this is where we see a really fascinating and I think diagnostically crucial evolution from a state of clarity and being sociable to one of just profound mental fatigue. You see, this mental evolution is clinically vital. The patient, they might present initially as quite intellectual, excitable, even very talkative. But then, under the strain of prolonged mental exertion, they just deteriorate. They develop a real aversion to conversation. They become mentally weak and forgetful, simply because they lose the thread of their own thoughts and social interaction becomes utterly exhausting. So the intellectual faculties, they're the first to suffer, and they suffer the most profoundly. This makes it a key remedy for what we call brain fag, in burnt-out professionals, students, public speakers. And notice this peculiar hurried feeling, even while time itself seems to drag on forever. This is often coupled with a real anxiety about their declining health and an emotional balance that's just so easily thrown off by anger or fright. All right, so now let's see how this deep constitutional decay actually manifests physically across all the different systems of the body. Okay, if you remember just one physical keynote from this entire discussion, let it be this one. This is perhaps the single most important physical sign of the remedy. Wherever you find a mucous membrane secreting, I don't care if it's the larynx, the nose, the urethra, you look for this characteristic mucus. It is thick, it is gray, it's tenacious, and it has the unmistakable appearance of boiled starch. This is a confirmatory symptom of the highest order. The larynx is a major, major center of action, and this makes it an absolutely indispensable remedy for voice-related complaints, especially in these exhausted individuals who use their voice professionally. Think of the hoarseness, the total loss of voice, and that very peculiar sensation of a raw spot right above the sternum. And of course, remember the modalities. The cough is triggered by laughing, and they have to constantly clear their throat when they're reading aloud. Now, the nervous system. This is where things get really unique. The pain modality is a defining feature. The pain builds gradually to a peak, and then it just stops abruptly. The headaches are often left-sided and feel very deep. Also, pay close attention to the nervous system hyperexcitability, particularly those violent electric-like shocks that jolt the patient just as they are drifting off to sleep. The affinity for cartilage is profound. So I want you to think of Argentum Metallicum for those deep-seated joint pathologies, the ones that often have thickening and infiltration, but they don't have that typical red, swollen appearance of an acute inflammation. And also, watch for this peculiar keynote, a sensation of contraction in the calves, this feeling that they're too short, particularly when going downstairs. In the male sphere, there's a keynote that's just unforgettable, and it's highly characteristic, a crushed pain in the right testicle. It's often the result of chronic inflammation, and the area becomes exquisitely sensitive to the touch of clothing or even just the jarring of walking. And you'll often see this in a context of sexual weakness, maybe following onanism or sexual excess. Now, for female pathology, the laterality shifts over to the left side, so remember the strong affinity for the left ovary. The patient will describe a painful, swollen sensation there, often in conjunction with a uterine prolapse that really stems from the same deep constitutional weakness. It's also a remedy to keep in mind for deep cervical pathology and climacteric hemorrhages. So now that we've seen this really rich symptom picture, the big question is, when do we actually consider prescribing Argentum Metallicum? Let's take a look at the triggers that can bring on this state and the specific clinical conditions where it is proven most effective. These are the primary causative factors that can initiate that Argentum Metallicum state of constitutional breakdown. The history of the case is so crucial here. You always have to inquire about a history of sexual excess, prolonged mental overwork, maybe an iatrogenic illness from mercury abuse, or any significant emotional shocks. You can see that the clinical utility of this remedy is really broad. It's not just for the larynx or for the joints, its action is deep. It spans from those issues all the way to profound endocrine and sexual sphere disorders, like diabetes, orchitis, and ovarian conditions. And all of it is rooted in that same picture of constitutional collapse. Okay, modalities. As you know, these are absolutely critical for accurate prescribing because they give the remedy its unique character. So let's clarify what makes an Argentum Metallicum patient better or worse. The modalities here are very precise. The aggravation from using the voice is paramount, as is the worsening from touch and mental strain. Now, conversely, motion and walking provide relief. The pains can actually be so severe they drive the patient to get up and move. And I want you to note the paradoxical thermal modality. While they're generally a chilly patient who is better from heat, some symptoms, like their vertigo, can actually be aggravated by entering a warm room. Argentum Metallicum is its closest analog, and believe me, they can be very easily confused. Both have that profound weakness of the chest and a cough that's aggravated by laughing. But the differentiators are precise. The pain modality is key. Argentum is gradual up, sudden down. Stannum is gradual up and gradual down. And the character of the sputum is completely different. Also, stannum's weakness tends to be more all-pervading, whereas argentum's is often worse specifically on the left side of the chest. All right, finally, let's distill all of this information down into some practical, memorable tips that you can take directly into your practice and prescribe with much greater confidence. These 3 symptoms, they're so peculiar and so characteristic that when you see them together, they form an unmistakable signature for the remedy. It's almost impossible to get it wrong if you have these 3. So let's lock in the prescription with these final points. Think of that broken down professional archetype. Remember the specific laterality, left ovary, right testicle. Do not forget those violent electric-like shocks on falling asleep. When you see these points alongside the confirmatory trio we just saw, the raw spot, the starchy mucus, and the sudden stop to the pain, you have an undeniable case for Argentum Met. This is a remedy for deep insidious pathology, not for superficial complaints. And so I'll leave you with that thought. Go back and consider your current caseload through this new lens. That patient you have with the lingering hoarseness, the strange joint pains, or that profound mental burnout. You might just find that Argentum Metallicum is the key you've been looking for.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.